So consumer-centric care, you brought this one up. I'd love for you to tee this one up.
Yeah, so consumer-centric care is another one of the catchphrases of the last year and a half. And when I hear it as a primary care physician, CIO, I hear it thinking it cannot be consumer because patients come different than a consumer. If I walk into my local appliance store or my local auto dealership, I'm truly a consumer. I'm able to be informed about the product, come in with my money. I know how the interchange is going to happen. I pretty much control a large portion of that interaction. And the most important thing, I don't need either of those. I may want those things, but I don't need them so I can walk. As a patient, I need care, and I come fearful, and I don't really understand the pricing. And even with posting the charge masters, I still have no clue what the pricing is for hospital care, and no immediate ability to fully understand that. No one's going to immediately understand all the abbreviations, the codes, even if you put it out as DRGs. You know, it's just hard for the patient to really understand it, and particularly in a moment of stress. So I kind of rebel against the consumer-centric. I think we need to think more, how do we care for people holistically and in a way that does work to delight them? I mean, the consumer catchphrase of a couple of years ago was delight. You know, anything I present to people should delight them. Well, I always thought that way about my practice. I always wanted a patient leaving anxious to tell 5 more friends, you need to go see Dr. Bensema. And if you approach it with that attitude, then you are always going to be focused on the patient. Now, that doesn't mean you give them everything they want. It means you explain your rationale and you engage them and partner with them in that care. But to call it consumer-centric, I just think is a misnomer.